Thank you, Governor. Good afternoon, everyone. Thank you for being with us. Our data, as you've heard, is generally in the same place. They were in on Wednesday. We have the 482 new cases to report. Again, way more cases than we want to be reporting in any one day. We have 152 people currently hospitalized. 15 people are in an intensive care unit, and 9 people are on a ventilator throughout the state. As mentioned, we sadly have 6 new COVID-19 associated fatalities to report. 2 people were in their 50s, 1 person was in their 60s, 2 people were in their 70s, and 1 person was in their 90s. Our sympathies are with the families of these Rhode Islanders. Before taking questions, I want to spend a minute or two giving some insight into what the governor has shared and what's driving behind it. We've been talking the last few weeks about that critical shift, wearing masks in those informal settings where we see spread occurring the most. A lot of what we're saying here is being able to pause and reassess what changes can we make to ensure that all of us start adopting that new way. The socializing that's occurring in work settings, socializing that's occurring related to sports events, socializing that's occurring related to loved ones, being in healthcare facilities. How can we adjust so that we can have a different approach as a society to knowing we have to keep our groups small, we have to limit how many times we're doing that socializing, and when it does occur, we have to wear our masks. It's the critical way to stop transmission. We've been talking about informal social gatherings every single week. This consistently is our #1 problem. Our social gathering numbers are not getting any better. For the last 2 months, our social gathering size has been roughly 25 consistently. That was when 15 was the cutoff. We're dropping it to 10. We need people to really cut back. If you're going to just get together, we have to stop doing that. We have to avoid it and make sure that when it is less than 10 individuals, we are wearing our masks. It's the same group, we're keeping it consistent, and we have to wear our mask. Another thing to consider is that all the data we have on social gatherings are self-reported. When people have social gatherings that are larger than they're supposed to be, the estimates provided to us are probably underestimates in some situations. And there are people who we suspect went to larger social gatherings, but who refused to answer questions when we did case investigations. This is a critical point. We've talked about the stretch that has occurred on our case investigation and contact tracing team because of the increasing number of contacts that people have. If we can get those numbers down, cut back on all the people that you're interacting with, make sure that with that smaller group you are wearing a mask, that will allow us to start moving forward more effectively and cooperate with us. The more you can give us the information we need to help keep you and the people around you safe, the more effectively we can work, the quicker we can work. When we have a tough time getting that information, that slows down the entire system in terms of people waiting online, on the phone, trying to get through, because we're working even harder to get information where people have more contacts and they're not sharing. We want to work with you. We have a team of people who are committed to this. We need you to continue to give the information that's necessary. Another issue we're aware of when it comes to social gatherings is that some families and high school students are canceling larger parties, but are instead holding gatherings that are slightly smaller without the intention of wearing their masks as they're doing it. We need you to ensure that masking is critical when you're around anyone that you don't live with, and we need you to keep your groups consistent and small. Keep your social interactions limited to the same people. Really cut back. We need your attention to stop all of the different socializing that's happening. Switching gears to look at houses of worship. Between October 13th and October 19th, we had 20 cases who reported attending a social gathering. These cases had an average of 5.11 contacts. The previous week, we had 30 of these cases. At one of those religious gatherings, there were 200 people in attendance. Religious leaders have worked hard to do the right thing. They've been excellent partners. We are enormously appreciative of all that they have done and will continue to do to help amplify this message. But as the governor said, these are very familiar settings for many of us. It's not only what happens within the religious gathering, but it's people socializing before and people socializing afterwards. We need to break those old habits. We need to be wearing our masks when there's any type of interaction with anyone outside your household. When coupled with the fact that it is many older Rhode Islanders who are going to places of worship, that's a recipe for tragic health outcomes that we can avoid. We don't have to let this happen. This is the key, is we have this moment before it's too late, where we need to be able to pause, see what to do differently, really get everyone's attention to understand the alarm that's in place, and then see how to move forward with wearing masks effectively, keeping our groups small, and keeping our distance. When it comes to sports, we want to give kids the chance to exercise, to be outside where they can run around and be healthy. That's incredibly important. We want sports to continue happening. But the bottom line is that if we don't get our cases under control, sports, which can make up a fair number of the cases that we are seeing, could get even more restricted. This is our opportunity again to pause, see what we can be doing differently. It's not only the sport event itself, it's what's happening beforehand with people socializing, it's what's happening afterwards in the locker room, folks getting together to celebrate. As the governor mentioned, all normal things, all things that we have to stop right now. I know this change is hard to hear for a lot of people, especially the parents and students and athletes who are involved and who love more than anything else to be engaged and play, and for the parents that want to watch their kids play. But this is something we need to do in this short amount of time. We can really have the impact we need so that we can go forward better on the other side. We can prevent the spread of disease. And as I said on Wednesday, we have that power to do so. Every individual does. If you're with anyone you don't live with, make sure you're wearing that mask. We all just need to take the steps to keep ourselves and those around us healthy and safe.